Some energy drinks want to scare you. Some even want to bully you around. And the others, they're just blowing smoke. Packed with vitamins B3, B5, B6, and B12, the new HiQ energy drink comes available in 4 exciting flavors. Skyberry Fusion, Apple, Coconut Fruit Punch, and Lemon Lime. Natural caffeine, no preservatives, no crash, no bull. HiQ energy drink. Wings are for birds.
Rudo Apparel powers teams and athletes around the world by offering the best in customer uniforms at an unbeatable price. Visit RudoApparel.com or give them a call today at 347-850-2720 to build your one-of-a-kind uniform made just the way you want. Rudo Apparel, the #1 shop for custom uniforms and apparel. That's 347-850-2720.
Welcome to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness throughout your journey in life. Your host is Dr. Emran, a respected physician who's treated thousands of people just like you over the past 10 years. Listen to the show each week on iTunes, iHeartRadio, Spreaker, and 3 and Out Radio Network. Information provided on this show is not a substitute for professional medical advice. Always discuss your questions with your doctor or go to your nearest emergency room immediately.
Thank you so much for joining us today on Simple Health Radio. I'm your host, Dr. Emran. We have a very special returning guest today, Tawana Jackson. She was on one of our last episodes, and she talked about mental health crises in America, as well as some of the resources that are available. She is the CEO and organizer of recoverywarriors.org. She has a LinkedIn page as well as a Facebook page, so you can search for recoverywarriors.org. Her phone number is 678-558-9330, and we are delighted that she's returning today as a guest to be on our show. Are you there, Tawana?
I am here, and thank you again for allowing me that opportunity to be on this platform. Just great to be able to just spread awareness, not just here locally in the Atlanta area, but out there in Texas. So thank you again, Doctor. I really appreciate the opportunity.
Absolutely. Thank you. And we had some really great feedback from our last episode. We had a lot of callers and people on social media that wanted to thank us for having you as a guest on, and they found out about some resources that they'd never had even been aware of. And so I'm glad that we were able to promote awareness about some of the anxiety, depression, and the bipolar topics that you discussed in the last episode. So thank you again for being with us today.
You're most welcome, sir.
Very good. Now, today we're going to shift gears a little bit, and we had talked a little bit off air about some of the crises, not just mental health, but other crises that are facing Americans. And you have some experience in what we call infectious disease. So can you tell me a little bit more about some of those aspects of the healthcare and some of the things that you've been involved with infectious disease?
Well, working in the behavioral health field, dealing with that type of population, there are quite a few people that I work with on a day-to-day basis who are infected with either like an HIV type of infection or Hep C. So just working in an environment to where I'm exposed, and when I say exposed, sometimes the situations call for people aren't in the best of health. So working in an environment like that, I'm really a huge advocate of free testing. When people are subjected to those type of infectious diseases and not getting the required medicine or care, it costs us, and I don't like to put dollars first, never over human lives, but it costs more money on the front end if we were to just use preventative measures such as contraceptives, testing and knowing your status. The other week was a National HIV Awareness Day. I think it was last month, it's about a week or so ago, National HIV Testing Day. And I encouraged several peers, and usually I end up going and get tested like every other month because I usually have a peer that'll come in and they're afraid it's their first time, or they might have engaged in some type of risky behavior, and they want me to go with them. So I'll go and I try to lead by example to show them, hey, it's okay. It doesn't hurt. It's a little prick. They can let you know within 15 to 20 minutes, and you can carry on with your life. So it's really imperative that we know to practice safe sex, go get tested, use those free resources, and actually know what some of the to HIV. I mean, it's not a death sentence. A lot of people think it is, but I work with people who thrive, and they live really great, productive lives, although they live with those infectious diseases.
Absolutely. And I agree with you on a lot of those points. And as an ER physician, it's not the first place that